Imagine a world in which your perceptions and your reality differ dramatically from those around you. What if the beliefs that shape every thought and action you take were not only different, but completely detached from what others consider real? Today we will explore the myths and facts surrounding delusional disorder, a condition that calls into question our understanding of reality. Welcome to Wellness Lenses, where every conversation is a deep dive into mental wellness and psychology. Let's talk about delusional disorder. This is a frequently misunderstood condition, overshadowed by more well-known conditions such as schizophrenia. But did you know that delusional disorder is a distinct condition? It is distinguished by fixed, false beliefs that persist despite evidence to the contrary. But these beliefs are not accompanied by hallucinations or disorganized thinking found in other psychotic disorders. Delusional disorder is a mental health condition defined by persistent false beliefs, or delusions, held with strong conviction in the face of evidence to the contrary. These beliefs are not influenced by cultural or religious norms, and they usually involve scenarios that could happen in real life, such as being followed, deceived, or conspired against. Individuals with delusional disorder, unlike those with other psychotic disorders, rarely experience hallucinations or significant impairments in cognitive functioning. The fixed nature of these beliefs, which can be bizarre or plausible but are maintained despite contradictory evidence, is a distinguishing feature of delusional disorders. Delusions in delusional disorder can take many forms, including persecutory, like feeling targeted or harassed; grandiose, like believing oneself to have exceptional abilities or status; jealous, like believing a partner is unfaithful for no reason; somatic, like believing one has a physical illness or defect; and more. These beliefs are often upsetting for the individual and can influence their behavior and relationships. So now let's separate fact from fiction. Myth. People with delusional disorders are always dangerous or violent. In reality, most people with delusional disorder are not violent. These beliefs are deeply personal, and they frequently result in withdrawal or attempts to protect oneself rather than harming others. According to research, violence is not a common feature of delusional disorder, debunking the widely held misconception. Fact. Delusional disorder can coexist with other mental health conditions, but has a distinct presentation. Research has demonstrated the significance of accurate diagnosis and tailored treatment approaches. Studies on this topic emphasize the importance of conducting a thorough psychiatric evaluation to distinguish delusional disorder from related conditions such as schizophrenia or mood disorders. Have you ever met someone with delusional disorder? I'd love to hear your story in the comments section. Sharing our experiences allows us to better understand this condition and how it affects those who live with it on a daily basis. Also, if today's topic is something that appeals to you, please consider subscribing to our channel for more content on mental health and psychology. We're now also on Substack, so check the link in the description box below. Myth. Delusional disorder cannot be treated. The truth is that while delusional disorder is difficult to manage, it can be effectively treated with medication and psychotherapy. Antipsychotic medications have been shown in studies to reduce delusional beliefs and improve overall functioning. Psychotherapy, particularly cognitive behavioral therapy, assists individuals in challenging and reframing delusional beliefs, thereby promoting long-term recovery. Fact. Family and friend support is critical to recovery. Understanding and empathy from loved ones can greatly improve treatment adherence and outcomes. According to studies, a supportive environment is essential for effectively managing delusional disorder. Myth. Delusional disorders are rare and uncommon. Many people believe that delusional disorder is extremely uncommon, outweighed by more widely recognized mental health conditions such as depression or anxiety. However, research indicates that delusional disorder is more common than previously thought, affecting roughly 0.2% of the population. This prevalence highlights the importance of raising awareness and understanding among healthcare professionals and the general public. Fact. Delusional disorders can range in severity and impact. While some people may have minor symptoms that do not interfere with their daily lives, others may face significant difficulties maintaining relationships, employment, and overall functioning. The severity of delusional disorder can vary over time, depending on stress, life events, and adherence to treatment. Effective management frequently requires ongoing support and monitoring to address changing needs and symptoms. Myth. Delusional disorder is caused by a lack of character or personal flaw. There's a common misconception that people suffering from delusional disorder are somehow to blame for their situation or lack mental strength. In reality, delusional disorder, like other mental health conditions, is a result of a complex interplay of genetic, biological, and environmental factors, understanding, and empathy are critical in assisting people with delusional disorder on their path to recovery. Fact: early intervention and accurate diagnosis are critical for successful treatment. Research emphasizes the importance of early diagnosis and treatment for delusional disorder. Early detection enables the prompt initiation of appropriate treatments, such as antipsychotic medications, psychotherapy, and support from mental health professionals. According to studies, early intervention can lead to better long-term outcomes and a higher quality of life for people with delusional disorder. As we wrap up our exploration of the myths and facts surrounding delusional disorder, remember that knowledge is power. By dispelling myths and accepting facts, we pave the way for compassion and understanding. If you found valuable information in this video, please give it a like, share it with your loved ones, and don't forget to subscribe. In case you missed it, we're now on Substack. You can get free summaries of each video if you subscribe. And if you want full details of each video's topic, with references and helpful resources, we offer a paid subscription for a small fee. Just click the link below. See you in the next video.